Hello everyone, myself Fathima Thahsin, Assistant Professor, Department of Pharmaceutics. So today's topic is capsules. Discussing the table of contents, it includes capsules, advantages and disadvantages, types, summary and references. So specific learning objective, at the end of the session, the student should be able to know about the capsules, to understand capsule types and composition and various manufacturing techniques of capsules. Moving on to the introduction of capsules. Capsules can be defined as a drug substance in which the medicament is enclosed in a hard or soft water-soluble shell made up of gelatin. It is also defined as a dosage form in which one or more medicinal or inert substances are enclosed within a small gelatin shell. Coming to the advantages, it masks the taste and odor of unpleasant drugs and it can easily be administered. It is attractive in appearance and when slippery, these are moist and are easy to swallow with a draught of water. The shells are physiologically inert and can easily and quickly be digested in the gastrointestinal tract. They are easy to handle and carry, and the shells can be opacified and thereby it can be given protection from light. Coming to the disadvantages, the drugs which are hygroscopic absorb water from the capsule shell, making it brittle and hence it is not suitable for filling into the capsules. The deliquescent materials, it cannot be incorporated, therefore they may cause hardening or brittle of the capsules. Now there are two types of capsules, which is hard gelatin capsule and soft gelatin capsule. First one is hard gelatin capsule. So these shell capsules which are typically made using gelatin and they contain dry powdered ingredients. These are made into two halves. The lower diameter part is called as the body, which is filled and then sealed using a higher diameter called as the cap. So soft gelatin capsules, these are primarily used for oils and for the active ingredients that are dissolved or suspended in oil. It is also called as one piece, unlike hard gelatin capsule. In addition to the ingredients of hard capsule, they consist of plasticizer like sorbitol, propylene glycol, glycerin, etc., which are mainly added to increase the flexibility. Now the differences between hard and soft gelatin capsules. So the hard gelatin capsule, it consists of two different parts, which is body and the cap. Whereas soft gelatin capsule shell, it becomes a single unit after sealing the two halves of the capsule. Hard gelatin capsule is cylindrical in shape, whereas in case of soft gelatin capsule, they are available in round, oval and tube-like shapes. The hard gelatin capsule, the contents are mainly consisting of the medicament or mixture of medicaments, mainly in the form of powder, beads or granules, whereas the contents of soft gelatin capsule, they are filled of liquids or solids dissolved or dispersed in suitable excipients to give a paste-like consistency. And hard gelatin capsules are mainly prepared from gelatin, titanium dioxide, coloring agent and plasticizer, whereas soft gelatin capsule prepared from gelatin, plasticizer and a preservative. In case of hard gelatin capsules, the capsules are sealed after they are filled to ensure that the medicaments may not come out of the capsule due to rough handling, whereas in the case of soft gelatin capsules, filling and sealing is a simultaneous process. Next, raw materials for capsule shell, that is composition of shell. So the raw materials which are used in the manufacture of both hard and soft gelatin capsules are similar, and first one is gelatin, which is the protein product that is produced by partial hydrolysis of collagen extracted from the skin, bones, cartilage, ligaments, etc. The natural molecular bonds between these individual collagen strands are broken down into a form that rearrange more easily. Gelatin melts when heated and solidifies when cooled again. Together with water, it forms a semi-solid colloidal gel. There are two types of gelatin, which is type A and type B. So type A is derived from acid-treated precursor that exhibits an isoelectric point at pH 9 and is mainly manufactured from animal bones. Whereas in the case of type B gelatin, it is derived from alkali-treated precursor that exhibits an isoelectric point at pH 4.7. It is mainly manufactured from pork skin. Next is the colorants. So it is used to identify a product in all the stages of its manufacture and use. There are mainly two types. Type A is water-soluble dyes and B insoluble pigments. Examples of water-soluble dyes includes erythrosine, indigo carmine and quinolone yellow. And in case of insoluble pigments, iron oxides which are black, red and yellow and titanium dioxide which are white and are used to make the capsule opaque. So capsules are colored by the addition of colorants to the gelatin solution during the manufacturing stage. Other than that, there is process aids wherein preservatives and surfactants are added to the gelatin solution during capsule manufacture to aid in the processing. Gelatin solutions are an ideal medium for bacterial growth at a temperature below 55 degrees Celsius. So preservatives are added to the gelatin and colorant solutions to reduce the growth of microorganisms until the moisture content of the gelatin film is below 16% weight by volume. Preservatives like sulfur dioxide, which is used as sodium salts of bisulfate or metabisulfate, sorbic acid are another examples of preservatives which are added. Another example of preservatives, it is mainly added to prevent the microbial growth during the manufacture. Diluents like lactose, mannitol, sorbitol, starch, etc. are also used. And in case of lubricants and glidants, talc, magnesium stearate and calcium stearate are also added to the capsule shell. Wetting agents like sodium lauryl sulfate and disintegrants also include in the list. Next, coming on to the production of hard capsule shell. So here in this, the metal molds at room temperature are dipped into a hot gelatin solution which gels to form a film. This is then dried, cut to length, removed from the molds, and then these two parts are joined together. These processes are carried out as a continuous process in large machines. The different steps that is involved in the manufacturing of hard gelatin capsule include dipping, spinning, drying, stripping, trimming and joining, and polishing. So first, the stainless steel pins are used on which the capsule is formed. 150 pairs of these pins are then dipped into the gelatin solution of carefully controlled viscosity to form the caps and bodies simultaneously. The pins are usually rotated to distribute the gelatin uniformly, during which time the gelatin may be set or gelled by a blast of cool air. The pins are moved through a series of controlled air drying for the gradual and precisely controlled removal of water. The capsules are stripped from the pins by bronze jaws and trimmed to length by stationary rives, while the capsule's halves are being spun in chucks or collets. After being trimmed to exact length, the cap and body sections are joined and ejected from the machines, and this whole time it will last for about 45 minutes. Now coming to the size of capsules, the capsules are available in various sizes ranging from the number 000 to 5. So the capacity of the capsule number 000 holds about 950 mg and 5 it holds about 100 mg in total. So soft gelatin capsules, these are one-piece hermetically sealed soft gelatin shells containing a liquid, a suspension or semi-solid. This is mainly composed of gelatin, plasticizers, preservative, coloring and opacifying agents, flavoring agents and sugars. The application of soft gelatin capsule includes, it is used as an oral dosage form and also as a suppository dosage form in pharmaceutical industries. Coming to the nature of the shell and capsule content, soft gelatin capsule shell is basically composed of gelatin, plasticizer, coloring agent and opacifying agent. The presence of iron is always there in raw gelatin and its concentration depends on iron contents of large quantities of water used in manufacture. Gelatin used in the manufacture of soft capsules should not contain more than 15 parts per million of iron because of its effect on food, drug and cosmetics, certified dyes and its possible color reactions with organic compounds. Soft gels are suitable for non-aqueous solutions and they are known to melt within a few minutes in the stomach. Now coming on to the packing and storage of capsules, it should always be packed in well-closed glass and plastic containers and stored at a temperature not exceeding 30 degrees Celsius. These are individually protected by enclosing in a strip and blister packaging. In strip packing, the capsule is hermetically sealed within the strips of an aluminum or plastic film, and in blister packs, a press on the blister forces the capsule through the backing strips. They have a larger shell in unopened glass bottles than in strip packing and vice versa. Coming to the conclusion, that is capsules, these are solid dosage form consisting of a shell usually made from gelatin or plant-based materials that encloses active pharmaceutical ingredients or excipients. Capsules offer multiple benefits including the ease of shallowing, effective taste masking, rapid drug release and the ability to encapsulate a wide variety of formulations, enhancing patient compliance and therapeutic outcomes. While capsules are not devoid of challenging, their advantages make them a preferred choice for many formulations when ongoing advancement, aiming to overcome their limitations and broaden their applications. These are the references. Thank you.